Hi, my name is Dr. Dillon Remmick here with HealthSource Chiropractic in Baxter, Minnesota. Just here with a little bit more information on a new fantastic tool that we have for people that have issues that many times can't get help anywhere else. And so one of the most common things that people struggle with that can't find really a right answer is severe arthritis, disc bulge, disc herniation. What happens when the disc bulges out and it compresses the nerve and it causes a lot of pain. So this is one of our new tools. It's called Spinal Decompression. And I'm going to explain really what that's specifically used for. But many of the patients that come in with this specific type of problem typically have a variety of symptoms. Obviously back pain and or neck pain, arm pain, burning pain, numbness and tingling sensations going down their arms or their legs, weakness. And most of these patients have tried lots of different things. Whether it's they've tried medications, whether it's they've tried injections, nerve burns, they've done physical therapy, maybe even seen other chiropractors before, and just really haven't had the right answer, and maybe they're getting suggestions to go into surgery, and obviously they don't want to do that. So I'm going to show you what type of symptoms these are specifically for based on what an x-ray looks like. So I'm going to bring you over here. As we look at this picture, this is a picture of a lower back, okay? And this is a picture of this is what a spine looks like. Somebody's facing this way. We have bone, disc, as we go down the spine. This is actually an example of a bulging disc looks like. You can see how it's pushing out from the disc like a balloon and starts to compress that nerve, and you can imagine what kind of pain can actually show up. So the same thing we're looking at, but this is just an x-ray of it. This is bone, here's the disc, here's the bone, here's the disc. If you can see just below that, the difference between this disc here and this one, that disc is being compressed quite dramatically and compressing that nerve, which is leading to a lot of pain. So for someone like this patient that we're working with, this is how the machine is going to be set up. What it actually does is on the machine, once we get the person set up specifically, we unlock it, and as the machine is pulling, it's going to separate the machine and actually pull her discs open, just like it's going to pump the area. So what happens is the machine pulls open and opens the disc, and then when it closes back up, it pumps fluid to the disc, but it actually pulls those bulges back in. And the good news is, depending on the type of problem that she's dealing with, whether it's in the lower back or it moves up in towards the middle back, we can raise and lower the table to help make sure we're getting those discs specifically affected by how this is pulling. So what happens is this rope is obviously connected to her, and we set it specifically so it starts to pull those discs open. The cool thing about this machine is it talks back and forth with the patient, meaning that if it feels her tightening up or getting uncomfortable, it will reduce the tension that's pulling so that it tries to make it as comfortable as it can for the patient. So this is just one extra tool that we have that has been very successful with patients that deal with chronic disc problems, severe pain, severe arthritis. If you've never tried this before, give us a call, because this is an answer to a question that a lot of people have of, what do I do next? Before you go and get a surgery, come on over, give us a call, or comment below if you have some questions, and we'll see if this could be a right solution for you.